In 2019, the Eastern Mediterranean Regional Office of the World Health Organization developed a new approach for institutionalizing evidence-informed policymaking at the national level for countries. This was presented to the regional committee, to the ministers of health of the region, and it was approved by them as the basis for the program. This has now become the work that the regional office is doing in this area of work in collaboration with the countries. This new approach has certain specifications that are important to explain. We call it a multi-concept, multi-dimensional approach, and I explain why. So within those dimensions that I'm referring to, the first one is called integrated. That integration means bringing different conceptual ways of thinking about evidence-informed policymaking together. Those include knowledge translation processes, health technology assessment processes, includes evidence-based guideline development, clinical guidelines, public health guidelines, or their adaptation. It includes health surveys, data coming from national health surveys, and similar sources of national level representative data. Includes the sources of data coming from routine information, for example, disease surveillance, hospital information systems, primary care information systems, civil registration, and vital statistics data. And also includes ad hoc studies that are usually conducted at the national level for important questions that policymakers are addressing and answering. So bringing all those conceptual approaches to evidence-informed policymaking together and making sure they are integrated together. We know that not all countries have all these programs, so this has two elements. If the country has those programs, how to enhance the processes so that those programs talk to each other. If the country doesn't have those, while establishing the processes and enhancing their institutional capacity for those, ensuring those enhancements are happening in an integrated way. So this is the first dimension. The second dimension is about whether the country wants to develop knowledge products required for evidence-informed policymaking, let's say health technology assessment reports, guidelines, policy briefs, systematic reviews, whatever knowledge product that helps the decision maker to make the correct decision depending on the type of question they have. Whether the country wants to adapt knowledge developed from other parts of the world to their context, or whether they want to develop them de novo. Again, this is not a simple question, but the countries decide based on the capacity that they have, based on the specifications of the question and the context, and decide whether to go for the process of adaptation from other sources or developing de novo. So this is another dimension that is important. It requires also tools and capacity, which WHO is working on and supporting countries to enhance those capacities. The third dimension is academic institutions' involvement in the process. Are they as a partner or as a collaborator? What role they would play in the process? Because producing those knowledge products requires a lot of academic capacity. So it could be through some of the functions can be handed over to academic institutions to provide the answers for policymakers, or could be their involvement in different stages. Again, this is a decision a country makes in terms of the process. The fourth dimension is about stakeholder involvement. Ensuring different stakeholders are part of the process is a major element of successful evidence-informed policy processes. Having said that, the country needs to decide which stakeholders for what type of policy, and also at what level of decision making, when and how they should be involved and be engaged in the processes. This would also define this dimension. And the last dimension is about the formality of the process. Evidence-informed policy-making processes are time-consuming. They could be also costly, and they may involve a lot of resources, human resources, technical resources. And not necessarily every decision that a policymaker makes will go through all these processes. So it's important, again, to be explicit. What sort of decisions, at what level, they need to go through what processes, and which one of them could be through a more rapid process, less formalized processes. Again, this would be the fifth dimension. So highlighting these dimensions helps the country, helps the policymaker to design an institutionalization plan and to implement it in a way that responds to their needs. Whatever decision the countries make within these dimensions, as I said, integration, the WHO recommendation is it should be integrated program. In other dimension, other 4 dimensions, countries decide about what to do. But whatever that decision is, 2 conditions should be met. Otherwise, the evidence-informed policy-making processes are not going to help national decision-making. What are those 2 conditions? One is that the policymakers, the processes, should ensure that conflicts of interest are managed properly. What do I mean by that? The issue is that imagine you develop a process in which that there are certain evidence should be reviewed, should be presented to a committee for decision making, and then policy or those committees make the policies or recommend policies for the national policymaker. If the conflict of interest is not managed properly, if people are involved in those processes that they are conflicted, by that I mean, for example, they might have financial benefit from one recommendation against the other recommendation, then the decision-making process, regardless of how much focus and how much efforts have been put in evidence generation, may not be the best decision for the countries. The second key condition is that we understand that, for example, evidence-informed decision or policy option may not be approved by a policymaker. Policymaker has a choice to think of the different options and thinking, well, I mean, this may not work. The evidence may suggest this way, but there are other reasons that this may not be possible for me. If we are talking about these processes, the minimum condition is that the policymakers should at least look at the evidence provided to them and argue why they are not using that sort of evidence provided to them through the process. If a policy brief is developed by the best of knowledge, if there are recommendations out of that policy brief, and policymaker wants to ignore that discussion or to select one option against the other, that might be legitimate, that might be okay given the conditions of the country and given the limitations that the evidence has, we understand that. But that should become very explicit, should be presented to the decision maker and the decision maker argue why I'm not using this source. If these 2 conditions, management of conflict of interest and ensuring that the policy recommendations are observed, viewed, and reviewed by the policymaker, if they are met, then having all those processes, institutional capacity, will support policymakers. WHO function in these processes to help countries to find the best answers to the questions they have in terms of dimensions and help them to enhance the institutional capacity to improve evidence-informed policymaking.